Hey there, Tom Hulst from Hulst Jepsen Physical Therapy, and this is Tom's PT Tips. For today's tip, I want to talk about reducing forces on your neck when you have a neck issue. So as you guys remember, we have the injury equation. When forces on a tissue or a body part are greater than what that tissue can resist, we get pain, injury, or tissue breakdown. So today we're focusing on how do we reduce forces on the neck when we have a neck issue. Well, first of all, we need to understand the anatomy of where the pain is coming from. The most common tissues to break down in the neck, the most common source of neck pain, are the bottom 3 or 4 discs of your neck, the C4, C5, C6, C7 disc. This is very similar to the low back, where the most common source of low back pain is coming from L4 and L5 disc. Below the neck, we have rib cage that attaches to what we call the thoracic spine that limits the mobility of that part of your spine. On top of your neck, we have a 10 to 15 pound head that when it moves will tend to produce movement primarily through that lower part of the cervical spine. So these discs end up taking a lot of stress and pressure. So the focus on getting forces off those discs is on trying to keep that head as close as we can to neutral position. The most common positional fault we get with the head is we get the forward head position because our eyes are in front of us, our hands are in front of us, so we're going this direction a lot. When we go forward, you can see we pinch on those discs and we put a shearing force on those discs, like a forward shear force that tends to cause disc damage. So getting that head back to neutral helps get pressure off those discs. Now, the two most common things we do in a 24-hour period that can stress our neck are sleeping and sitting. So we're gonna do some video clips showing little adjustments you can make with those two things to get stress off your neck. Third issue is if there's any daily activities you're doing that are aggravating your neck, you need to limit or eliminate those activities. I herniated my C6 disc to the right about 10 years ago, and playing golf was one of my major aggravators of that. I would get increased numbness and tingling down my arm. I started to get weakness in that right arm. I had to stop golfing. Then I modified my golf swing when I returned to not stress the neck so much. If you make these changes, I'm confident you're gonna live with a more pain-free neck. Let's roll the tape.